Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them smoothly as silk. Today, we're shedding light on two rare poxvirus genera, Parapoxvirus and Yatapoxvirus. Before we begin, try your hand at these questions. Which rare zoonotic poxvirus genus is a concern for African travelers? What does ORF look like on the hand? Stick around. Parapoxviruses and Yatapoxviruses are both large, enveloped double-stranded DNA viruses that replicate in the cytoplasm, unlike most DNA viruses. Parapoxviruses, such as ORF virus and Pseudocowpox virus, appear ovoid or elliptical with distinctive spiral surface ridges seen on electron microscopy. Yatapoxviruses, including Tanapoxvirus and Yaba monkey tumor virus, show the brick-shaped or ovoid morphology typical of poxviruses. Parapoxviruses produce proteins that blunt the interferon response and limit inflammation, which explains why they cause localized rather than systemic infections. Transmission occurs through direct contact with infected sheep, goats, or cattle, or from contaminated tools and equipment. At highest risk are farmers, veterinarians, and slaughterhouse workers who regularly handle livestock. After an incubation period of 3 to 7 days, a localized nodular lesion appears on exposed sites, especially the hands and forearms. These nodules are firm, dome-shaped, often red-purple, and sometimes tender. They're called ORF when acquired from sheep and goats, or milker's nodules when linked to cattle. Only one or a few lesions typically develop, and they spontaneously resolve in 4 to 6 weeks. Complications are infrequent, but can include secondary bacterial infection or larger, slower healing lesions in immunocompromised patients. Like parapoxviruses, Yatapoxviruses show limited immune evasion and typically cause only localized nodular disease, without systemic persistence. Transmission occurs mainly through direct contact with non-human primates, via bites, scratches, or close exposure, with occasional human-to-human spread reported. People most at risk include those living in or traveling to equatorial Africa with monkey exposure, as well as laboratory workers handling primate tissues. The incubation period averages about 5 days, after which lesions appeared. Tanapox presents with a few papules or nodules, sometimes accompanied by fever, and resolves within 2 to 6 weeks. Yaba monkey tumor virus causes multiple larger nodules, sometimes more widespread, that also regress over weeks. Most cases resolve spontaneously, but complications can arise in immunocompromised individuals who may develop unusually large, persistent, or severe lesions. Despite their dramatic appearance, Yatapox infections remain rare and generally mild in healthy individuals. Neither Parapoxviruses nor Yatapoxviruses are linked to cancer, setting them apart from some other DNA viruses. Diagnosis is usually clinical. In parapox infections, recognition of characteristic hand lesions in livestock handlers is often sufficient. However, confirmation can be made with EM, polymerase chain reaction, or histopathology in severe or evasive cases. For Yatapox infections in endemic African regions, the combination of travel or primate exposure history with skin nodules usually makes the diagnosis. EM and PCR are reserved for confirmation in severe or atypical disease. Treatment for both groups is supportive since lesions heal spontaneously over weeks. Topical antiseptics may be used if secondary bacterial infection occurs. Antivirals are rarely needed. Agents like cidofovir or tecovirimat have been tried for severe cases in the immunocompromised, though routine management remains supportive. Prevention relies on reducing exposure. Parapox infections are warded off by wearing protective gloves and handling livestock safely, while Yatapox infections are prevented by avoiding close contact with non-human primates or using protective measures in laboratories. Currently, no vaccines exist for either group. Let's review our questions. Which rare zoonotic poxvirus genus is a concern for African travelers? Answer: Yatapoxviruses. What does ORF look like on the hand? Answer: a firm, red-purple nodule with the crusted or target-like center. Answered both correctly. Yowza! If you learned something from this video, help our channel grow by hitting like, share, and subscribe. Explore the comparison table from the link in the description. Thanks for watching. Follow Medin5 for more rapid-fire medical learning.